COVID-19 and Children, Part 3 Q&A. Separation from COVID-positive family member. In the last two videos of Q&A segment, we have discussed regarding COVID vaccination in children and queries of parents regarding certain symptoms in their children are of COVID or not. In this video, we are going to discuss what to do if a child is COVID positive and mother is not, and if a mother is COVID positive and a child is not. These scenarios will be discussed in this video in a manner in which they will help parents and guardians in tackling them. With that, let us start with the first scenario. What needs to be done in regards to children if caretakers are suspected or confirmed with COVID-19? Mother or primary caregiver is suspected or confirmed with COVID-19. Separation of mother from child is only advised if mother is very sick and needs ICU admission. No separation from a healthy dependent child is advised if mother is mildly to moderately ill. But in certain scenarios where child has comorbidities where the doctors themselves advise need for separation, then the problem arising due to separation of the child from the mother should be discussed with doctor along with other family members, and best possible decision should be taken keeping everyone's safety in mind. Note, this advice on separation only applies to dependent newborns and infants, while schoolers and adolescents can be separated from infected mothers until COVID subsides. Second, what needs to be done if child is tested positive and guardians are negative? It is highly unlikely. Only might happen if child has come in close contact with someone other than primary caregivers who is COVID-19 positive. During this time, mother or primary caregiver should continue looking after their children unless they themselves are at very high risk of severe disease and mortality due to a pre-existing comorbidities for which doctor has advised separation. During such difficult scenarios, another competent caregiver should be designated by the family members. How to know what are the comorbidities in a child or in the mother which call for separation? As the list is long and many a times needs to be decided on case-to-case basis, everyone in doubt on whether their condition warrants separation or not should consult their doctors. But in order to prime the viewers, few examples for comorbidities in mother or caregivers which warrant caution are old age, obesity, pre-existing lung disorders, pre-existing heart diseases, hypertension, diabetes, pre-existing renal disease, on immunosuppressive drugs or immunosuppressive state, etc. Before we conclude, let us see few studies from which this information was extracted. Look at this chart. This chart shows age-wise distribution of COVID infection, COVID severity, and COVID hospitalization. So as the age increases, the probability of hospitalization and the severity of infection also increases. Let us move on to next study. In this study, we see that underlying medical conditions in COVID-19 confirmed hospitalized cases. In this chart, we see comorbidities leading to hospitalization. And in the table, we can see leading comorbidities among COVID-19 deaths. Let us look at one last meta-analysis. This meta-analysis deals with comorbidities associated with mortality in 31,461 adults. Now let us look at the hard data one last time. The highlighted comorbidities are more statistically significant than the rest. So all these studies which we have seen now indicate towards the similar comorbidities which are dangerous and cause hospitalization and deaths in COVID-19 infected patients. If you have watched the video till the end, put down your thoughts on how you feel about such content along with what else you want in coming videos in the comment section below. If you like this video and don't want to miss on such informative content, like, share and subscribe and hit the bell icon below so that you are always updated on Indian and global COVID scenario and crisis.